I wanted to just talk with you a little bit today about Seminar 3. We have one coming up, and it's always so great to be at Seminar 3 and see the excitement that the students have during, after that class. And can you just give us a little insight on why you think that is?
Yeah, actually, I get really excited about Seminar 3 too, because that's one of the times when we change things to keep up with all the current opportunities we have with new technology and new methodologies and all. That's what we get to do in Seminar 3. And there's a formula that we follow here in the Seminar 3, and it starts with understanding two things, or two sets of criteria. The first is the criteria for success. There are 7 criteria for success that have to be fulfilled if we're going to absolutely have a successful result. And by success, I mean a stable result, a comfortable result, the very best aesthetics, the very best harmony of the total mask story system. There are 7 criteria, and they're all achievable when they're understood. And we base our treatment planning up front on those requirements or criteria for success, and make sure that each one of those is fulfilled in our treatment plan. Well, we piggyback with that with the requirements for stability. And by now I'm sure that our students know that by stability we mean that our finished result, the teeth are not loose, they're not wearing, and they're not drifting out of position, and that the tissues stay healthy and the joints stay stable and healthy. And those are the goals that we have when we start planning treatment for complex cases. Well, with that said, we then take every type of problem case a dentist may run into. By type, we'll take deep overbite problems, we'll take cross-bite problems, anterior open bite, posterior open bite, end-to-end cases, cases that are severe wear.
Severe wear, yeah.
Yeah, severe wear is a major problem that we address in detail, step by step. And a dentist has to use all of the understanding of treatment planning to know how to treat severe wear cases. And boy, there's plenty of them out there to treat too. That's one of the major cases that we treat in a restorative practice, and I have certainly treated hundreds of them through the years and have seen what it takes to end up with a stable result. We can be very successful in treating these cases if we understand what we have to do to accomplish stability as an end product in that.
One of my favorite times in Seminar 3 is when the students bring their cases, and in the afternoon after lecture time you all sit around in groups and actually look at those cases and treatment plan those cases.
Yes, and we encourage the dentists that come to bring a problem case because that's where you really get to see how the process works. It's interesting to know that you only have 5 options for treatment. And a general dentist following the process that we teach can sit down, I don't care how complicated that case is, how complex it is, by looking at the requirements for stability and understanding the criteria for success, and then looking, okay, which of these requirements are not fulfilled, what are our best ways to fulfill that with 5 options. We can reshape, we can reposition that, and that brings in orthodontics to quite an extent. In Seminar 3, we talk a lot about how movement of teeth can affect the end result, and a general dentist can figure these things out very well. And if we can't solve the problem with reshaping and repositioning, then we think in terms of restorative, and if we can't get it with those, then we can go to movement of dentoalveolar processes and sections, and finally changing the whole skeletal base surgically. So we have all 5 of those options, and we're going to try to settle on the most conservative option that we can for each patient. We also look at options that we have when patients require or should have major restorative procedures but can't afford them. What do? We talk about that, and And in our discussions after class, this is always fun because dentists are always asking, okay, now how do you get your patients to do this? So we have a lot of fun in talking about how to explain these problems and solutions to patients in a way that is acceptable to them.